everyone. So again in the next series we will discuss about the respiratory system examinations. So again for any system examination we have to take the consent from the patient whether we have examine him or her. बाबूजी अभी हम आपको चेक करेंगे, बच्चों को सिखाना है वीडियो पे कैसे क्या देखते हैं, आपकी परमिशन हो तो हम आगे कर सकते हैं. So now he has given the consent, we will take written consent also. So today we will discuss about the respiratory system, how we should go for examination of respiratory system. We know that each and every system is having four topics: inspection, palpation, percussion and the auscultation. So we will start from the respiratory system today. So after exposing the part which we are going to see, respiratory system, then we always stand just right on the patient and then look at the patient, any abnormality in the shape and size of the chest. By seeing that if there is any abnormality, one is left or right, which is downward or outward, any abnormality, is there any dropping of shoulder, is there anything in the trachea. For the trachea we have to see the trail signs. In trail signs what happens, there is these are the sternocleidomastoid and if trachea is shifted towards anyone, either in the right or either in the left, then that sternocleidomastoid muscle, the clavicular part will be the more pronounced, and that we used to call it as a trail sign. So by looking at the patient in size and shape of the chest, then the movement of the chest, whether the movements on both sides are normal or abnormal. If just stand in right of the patient and then you can see the movement of the chest, you see from behind also whether there is a abnormality in the movement of that. Then see the rhythm, it's a regular or not. If patient is having any respiratory some diseases, then the rhythm is also disturbed. Another thing is the type of the breathing. Usually there are two types of the breathing, whether it is a thoracoabdominal or it is a abdominothoracic. So in that patient you can see that it is a abdominothoracic, generally in the males, and in females it is a thoracoabdominal. Then come to the expansion of chest, whether expansion is normal or not normal. For that you have to again stand on the right and see the expansion of the chest, whether it is a normal or not. Then the next thing is the see the respiratory muscles, accessory muscles are working or not. You can see from nostrils to the respiratory muscles which assist in the breathing pattern. So if there is abnormality, then you may see the respiratory muscles working there also. So these are the parts which we have to see in the inspection. After the inspection, come to the palpation. And what we used to do in palpation we have to confirm the findings of the inspection, what we have find out in the during the inspection. If there is any trail sign positive, then we have to look for that by the palpation. We have to see the movements of the chest by the palpation. We have to see the tactile voctile parameters by the palpation. So start from one by one. So now we will see whether the trachea is central or not. If it is not central, then the trail sign is positive or not. Then how we will do that? You just put that your middle finger in between the your sternum part and then see. Bauji, so this is the method how you will see. Just ask him to just take the normal respiration. If trachea will be shifted, then you can feel it here only. So this is the for looking of the trachea, central or abnormal. Then by doing the palpation, the movements of the chest. For movements of the chest, we have to keep that hands like this and ask the patient, बाबा जी एक बार हाथ को यूं रखना. So there are different areas where we have to palpate. So for that areas this is a clavicle. So one is supraclavicular, clavicular, the infraclavicular, the supramammary, the mammary and the inframammary region. This is front. Then come to the axillary. Then this is the axillary part and this is the infraaxillary part. Same thing happens towards the back. So in back this is the scapula. So this is a suprascapular part, then scapular part, the infrascapular, and this is between the scapula. This is the interscapular part. So in all these areas we'll palpate the patient. Okay. So I can start from the back also. Babaji. Yeah. So by putting this both your hands here and then ask the patient to take the normal breathing. If there will be any abnormality, so coming and going back these two thumb size, Babaji सांस लो. So keeping hands like this is a supraclavicular region. You put your fingers here and then ask your patient to take the breathing normally. बाबा सांस लो आराम से. So the gap between these two, whether it's a both, in respiratory system we have always to just compare only. So you have to compare left and right. Yes, Baba ji सांस लो. So this is going, both are normal. You can see same here in the scapular. This is scapula. Then again you put both these. सांस लो Baba ji. Then same here in the infrascapular. From front also, this is a clavicle, then this is supraclavicular, then this is a infraclavicular, then this is a supramammary, this is a mammary, and this is the inframammary area. And in axillary, this is the axillary part, and this is the infraaxillary. So this is the palpation. By that you can see the any abnormality in the movements of the chest. बाबूजी नीचे रख लो. In palpation, after doing that, sorry, before doing that, we have to take the diameter of chest, and for that we need a inchy tape. So by that you may know the anterior posterior diameter and the transverse diameter. If there is any abnormality, that will tell you the shape of that patient, whether it is a barrel shaped or it is a normal patient, whether it is a pigeon shape. So confirm that, you have to take the AP and the transverse diameter. Next is TVF. What is TVF? TVF is a tactile vocal firmitus. In that case, we ask the patient to some phrases or verbs in the local language. बाबा जी मैं राम राम बोलूँ ना, तो दोनों यहाँ राम 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 यहाँ बोलना है ना. So just in that local language you ask the patient, and again same what you have done in the palpation in all areas, you keep your ulnar border on that the supraclavicular, the infraclavicular, the your supramammary, mammary. In the intercostal space, you have to check in both side lung field, and always keep it as a compare. So let's do it. बाबा जी आप राम राम बोलो.
राम 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 राम.
So this is the way how we have to do the TVF. By doing TVF, in some conditions there may be increase in tactile vocal firmitus, and so in some conditions where it is a decrease. The conditions where it decrease, as we know that in pleural effusion, in pneumothorax, there may be decrease. Okay. So this was the tactile vocal firmitus in these patients palpation. The third part is percussion. In percussion, we have to percuss the all areas we have done in the palpation. So again it is divided into the infraclavicular, clavicular, supraclavicular, the supramammary areas. And in percussion you have to percuss in both sides simultaneously. It's not like that you are percussing here and then going back. So you have to percuss in both sides simultaneously. Your right hand middle finger is pleximeter, your left hand middle finger is flexor, and third one, always keep a movement only at the wrist level. So this is a flexor, this is a pleximeter, and the movement at the wrist joint only. Again percuss in all areas. बाबा जी हाँ मुंह थोड़ा इधर कर लो, इधर इधर हाँ. So this is a flexor, this is a pleximeter, and now movement on the wrist part only. So in percussion we have to go either from top to down, because in resonant to the dullness. Here in lower part you can feel the lever dullness. So if any abnormality in the resonant, then there may be some pathology. It may be a pleural effusion, you won't be that will be the dull note, and there may be a story dull note also. Pneumothorax, you will not feel any you will feel hyper resonant. So these are the area where you have to percuss. After percussion, the last part is auscultation. In respiratory system, in auscultation, we have to auscult both areas on the left or the right lung, and The normal breathing sounds are the vesicular sounds and the bronchial sounds. Bronchial sound you can heard at the tracheal part, you can heard at the posterior at the interscapular part, or and if any abnormality towards that vesicular bronchial breathing, that will be the abnormal breath sounds. And abnormal breath sounds may be the wheeze you can hear, the crepitus you can hear. What the normal vesicular sounds? In normal vesicular sounds, there is a inspiration is longer. There is a no gap between inspiration and expiration. In vesicular, there is a rustling sound. What happens in the bronchial sounds? In bronchial sounds, there is a gap between the expiration and inspiration. The inspiration and expiration are almost the same. So normal bronchial sounds you can heard at the trachea level. Okay. If any other part you are feeling the bronchial breathing, that may be because of your any cavity formations. So start from the supraclavicular. बाबा जी नॉर्मल सांस लेते रहो. Again, all the parts same like the supraclavicular, infraclavicular, supramemory, inframemory, memory, axillary, infraaxillary at the back also. So this is the way we have to auscultate the patient, and we have to find out the breathing sounds are normal or not. If there is any abnormality, then we will go for the help in the diagnosis.